Good morning, everyone. So my name is Fatima. I'm a doctor. I'm a GP working in Lewisham with Dr. Funmi, who's my lovely colleague who's agreed to join us today. I also work for another organization called Doctors of the World, and that organization is involved in helping people who are vulnerable or maybe excluded from healthcare to access healthcare in the UK, to help with GP registrations, to help with knowing what you're entitled to and signposting to other services. So I will be doing a presentation soon, and then we'll have some question and answer, but I'll let Dr. Funmi introduce herself now.
Hi, everybody. I'm Funmi, and I'm also a GP. I work in Lewisham. I work in the same practice as Fatima does, and I've been involved, in some COVID vaccination webinars for Lewisham as well. So I'm actually really excited to be here, and I hope that we're able to reassure you and, answer your questions today. Thank you.
Okay, so I will start the presentation. Let's see. And I'll just talk you through some of it. There may be, maybe a lot of information, but we can answer any questions that come up from this. So this presentation is to discuss the COVID-19 vaccine that is being offered now. So the various vaccines that are being offered now, and to give you a little bit of background about the vaccine and in terms of how it was produced and potential side effects, potential concerns, and provide that information. So we're not kind of telling you about what decision to make, but more trying to provide the information so you're able to make a decision. So just to start off, kind of which vaccines are out there. So currently in the UK, we've got the AstraZeneca vaccine, which was made in association with Oxford University. Then we have the Pfizer vaccine, which was made in association with a company called BioNTech. And then we have the Moderna, which is the kind of newest kid to the block. So we don't know hugely about when that's going to be, given out to people. So it's probably not one that you're offered right now, but it might be in the near future. So just to say a little bit about the AstraZeneca and the Pfizer vaccines. They are a little bit different, and me and Funmi have definitely seen how they're different in terms of giving them to people, because they are very different ways of being stored. The Pfizer vaccine needs to be stored in a very, very cold temperature, at a very cold temperature, which means that it's not so easy to take out and about to people. But it can be useful at big vaccination centres. The AstraZeneca vaccine, that one is a bit different in that it doesn't need to be kept so cold. And so we can take it out in cool boxes that, aren't at freezing temperatures there, and it's very portable. So I'll talk a little bit more about why that's important later. So they also have slightly different ways that they were made, and different concerns that have been raised by the media for the various vaccines. So again, we'll come on to that. So about how they were made, and the reason I thought it would be useful to include some information is that I know there's a lot of people talking about how they were made, and there's a lot of fears around this. So if I just tell you based on my research and based on what's out there in the scientific research, so not what's on the media, but what's actually there in the pure science. So firstly, the Oxford vaccine, and I'm lucky in that one of my very best friends who's from Uganda is actually a researcher on the Oxford vaccine group. So I got a lot of information coming through, and I trust her very much. So she was able to send me research papers as well. So with the Oxford vaccine, the way that that's made is they take a harmless virus and they attach some material to it, which once it's inside you, it tells your body how to make a little bit of the protein that can now recognize coronavirus if it comes inside you and fight against it. So basically what it's like is it's like training soldiers to know how to fight the right enemy. So we already have this in our bodies for lots of different viruses, and that's why we don't get ill every single day of our lives, because there's viruses everywhere, they're flying around everywhere, but mostly either our bodies have already got the training to fight them. So what vaccines are doing is just giving you some training before actually getting the disease itself. It's saying, here, this is what you need to do if the virus comes into you. So both the ways that they're made is to recruit those kind of soldiers and say, here we are, we're going to fight this virus when it comes into us. So the mRNA one, that's the Pfizer one and the Moderna one. The way that that works, mRNA is not DNA. It's something different. And it never goes inside the middle part of the cell, which actually is the brain and has all the DNA. It doesn't get in there. So it doesn't change your DNA. It doesn't do anything along those lines. All it is the scientists, it's quite clever, they've taken a little piece of the coronavirus, little protein that sticks onto the virus, and taken the little code for that. So when that goes inside you, again, that code tells the soldiers what to do. It says, this is the protein you need to recognize, not the whole virus, just this tiny amount. This is what you need to recognize, like a hat on the virus or something. That's how we'll know it's the virus. And then they attack it if you're in contact with coronavirus. So I hope that's not too complicated. Please do let me know in the questions if that made any sense, if you want me to, or me or Funmi to explain that more. The other query sometimes that's brought to our attention is, how did they make it so fast? Because normally vaccines take years and years, usually 5 to 10 years to make. So the reason that it was made really fast is, if you think about it, the whole world stopped and looked at this COVID that had landed, and the whole world was like, well, what do we do about it? So all the resources of the world were focused on this. Let's make this vaccine. When you have billions of people all over the world with one aim, things can get done. So there's that quote about everything seems impossible until it's done. So that's what it seemed impossible, but obviously now we know that vaccine can be made that fast. The other thing to be aware of is there are stages in a vaccine trial, in clinical trials. There's multiple stages. And normally what happens is that you finish one stage and then you try and apply for funding for the next stage, and then you try and apply for funding for the next stage. And that's actually what takes a really long time, trying to get money to go on to the next stage. So what they did now is, obviously there was money because people wanted to cure this and wanted to find a way out of this. So the money was available. The other thing that they did was they didn't have to wait to go on to the next stage. In different areas, they were running all the stages at the same time. So if you think about all that happening at the same time, that's 5 to 10 years of work all happening simultaneously. So it wasn't like one person doing one task and then one task and then one task. It was hundreds and millions of people, well, hundreds and thousands of people doing all these tasks at the same time. So hopefully that gives some reassurance about the speed at which it was made. Okay. So the next question is, why do I need the vaccine? Why is it important? Is it really necessary? So I can tell you from a kind of a personal point of view, as well as being a GP, I've done shifts in the hospital and I've done shifts in intensive care to help the nurses, and not as a doctor, but just to help the nurses because they were so overwhelmed. And I've been seeing this. I've been seeing patients with coronavirus. We've been seeing them in the GP surgery as well. And they're very, very sick. So they can be. So people can get it at different strengths. You might get a very mild illness, but you might get a very severe illness. And this is the thing, you really don't know what kind of illness you're going to get, because young people are also getting the severe illness. And actually today I was reading some articles about Brazil and lots of babies getting it in Brazil, because they have such a high rate that even though it's rare in children, they're actually seeing lots of cases in children because there's so many cases. And that's quite scary for me. This is not a disease that affects, one type of group of people. It affects Black people, Asian people, white people, people from all over the world, people of every age. So everyone is potentially at risk. And the other thing is, even if you're not individually feeling like you're at risk, I'm sure you have people who you love, who you care about, who are at risk. And from my point of view, I think, we should care about all of us as society. So we should do things that are good for everybody. So someone mentioned in the questions in the survey about, if I'm young, why do I really need this? Do I need it? So that hopefully that answers that question, that although you're young, it's not a no risk situation. It might be a lower risk, but it's not no risk. The other thing to mention, which again, I think Dr. Funmi has seen a lot of, and we've both seen a lot of in GP, is something called long COVID. And long COVID is a condition that happens after a COVID infection, and it causes ongoing extreme tiredness, sometimes breathlessness, sometimes something called brain fog, which means you can't concentrate as much. Not everyone gets this after COVID, but many people do. And people who are previously working quite demanding jobs, sometimes, I've had to sign people off work because they weren't able to continue working. And it's really sad to see. So we want to reduce all this disease in the population and make sure that more people feel healthy day to day. So that's the other thing. With the vaccine, that's obviously one option for how we can try and get out of this pandemic. I've heard various people say, well, there are other options. We can wear masks, the masks help, or we can keep distancing. But when I think about it, I just think, what kind of life do I want to go back to? Do I want to go back to a life where I can never see anyone's face fully again, or I can never, sit with my family in the park and have a picnic because I'm so worried about, giving them COVID or passing it on? Is that really the life I want? And no, it's not. I want a life where we can have normal communication between human beings again. So for me, I can't see any alternative to this. And that made the decision much more easy for me personally to take the vaccine. So how about if maybe now you think that you do want the vaccine, how do you go about getting it? So there's various things to talk about here. So hopefully you're all registered with GPs, and please let us know if you're not and if you want any support, because that is what Doctors of the World is quite good at, supporting you with with GP registration. And that's important because a lot of the invitations for the COVID vaccine are going via GPs. So it's also useful to have that NHS number to get further medical care if you were to need it, although all emergency care is obviously free and accessible. In terms of getting to where the vaccine is being delivered, so often it's delivered in big vaccination centres, and that you might get an invite to there, but more and more we're seeing that there's a lot of community vaccine centres. So last week we vaccinated at the Lewisham Mosque for Muslim and non-Muslim people. So that was really good. It was nice, and we had a separate space for women if they wanted a different space for privacy. So I really enjoyed doing that and had a lot of lovely people who appreciated having that service. The other thing that's done a lot now across the UK is mobile outreach. So going out in vans or buses to take the vaccine to people who may struggle to get to us. So people who are homeless or with no fixed accommodation. So we were going out in our van to take the vaccine. And that's what, when I mentioned the AstraZeneca vaccine, why that's so important is that we can take it in the cool box. And it basically, the way the vaccines work, they all have pretty similar effectiveness, or something we call efficacy, which they were shown in the trials to be very good and very effective. So even the first vaccine, once you've had it, gives you 80% protection, approximately 80% protection. After both vaccines, it's more than 90% protection. So it's really high levels. So just a little bit about risk and what risk is. So we make decisions every day to weigh up risk. Every minute and every second of our lives, we make a decision. Every time anyone gets in a car or a bus, you're making a decision about the risk, because there is always a risk of something bad happening. And I'm quite an anxious person, so I have a lot of worries about risk. Every time I make a decision, I think a lot about the risks involved. But it doesn't stop me doing things. It just means I think about it a lot. And that's the same approach that I'd recommend taking to the vaccine. Let's think about it a lot, but let's make a decision by weighing up the risks. So something you may have heard a lot about is, and that's why I'm just going to address it outright, is this issue of clots related to the vaccine. And several countries, we've heard that they've paused giving out the AstraZeneca vaccine. In the UK, we're still giving the AstraZeneca vaccine, and I'm still personally giving it, and I feel comfortable giving it in the age group that we're allowed to, which is 30 years and over. And I'll explain why about that age group too. Just a little bit more about the risk of clots in general. So maybe people don't actually know this, but clots can happen to anybody, whether or not you have an underlying medical problem. So I could develop a clot tomorrow for no reason. Someone who's never been vaccinated could develop a clot for no reason. There are various things that make you more at risk, at high risk of developing clots. So if we look at this table, should have gone the other way around actually. If we start at the bottom of the table and actually look at COVID-19 disease itself. So for every million people, 147,000 people that got COVID will have clots. That's a huge number of people. So COVID-19 is a very clotting prone disease. And usually it's clots in the lungs or clots in the legs. And particularly if you're unwell enough to need to go to intensive care, then there's a very high risk. So this is the kind of thing we're trying to prevent. And looking at maybe as women kind of more day-to-day concerns that we have, so pregnancy and contraception. So pregnancy itself it gives you an extra level of risk, and nothing near COVID, but it gives you an extra level of risk of clots. So that's 1,000 per million people that get clots in pregnancy. So the oral contraceptive pill, the combined pill, so pills, for example, microgynon, that also gives you a slightly higher risk of having clots. So not huge, but it is a little bit higher. It's something to be aware of. And every doctor, if they're prescribing it, should weigh up your risks of getting clots to make sure it's safe for you to have. So that's 500 per million. So we still say keep taking the pill if you're taking it, because getting pregnant is much more of a risk of clots than the pill itself. So that's 500 per million. Now go on to the AstraZeneca vaccine. That's 4 per million. That's tiny, tiny amount. So compare that 4 to the 147,000 that we're trying to prevent by giving the COVID vaccine. The other thing to mention, just to give like a little warning to this, is that there are various types of clots. So different clots have been linked to different things. And the AstraZeneca vaccine, there was the concern that it was linked to clots in the brain. So it is something that still does need to have further research. And we need to be very honest about that so that we can keep doing that research, not to shut it away, to be open about it, but still to be aware that this is a risk, but a tiny risk. So which risk would we want? The risk of COVID and clots, or the risk of AstraZeneca and the tiny, tiny risk?
So I'm just going to have a quick chat about my experience of getting the vaccination. And so basically, the day I had my first vaccine, I was actually there to work as a vaccinator myself. So my aim for being there was actually to give people vaccines, and how best for me to practice what I preach than by taking it myself. So, there was no two ways about it. I was going to take it. And, I was when I heard that the vaccine, just going back, that, there was a COVID vaccine, I was very excited. I was like, wow, at least we can start thinking about ending this horrible pandemic. And, Fatima has talked about, of course, everyone's human. Everyone's thinking this is a new vaccine. Are we sure it's going to be okay, etc., etc. But then one of the things was that, this vaccine, was not, it wasn't just done in one day and then rolled out the next day to the whole population. The clinical trials happened. There were trials that were done, and it was shown to be effective, and it was shown to be safe. So there was no two ways about it. I was very, very happy to have it. So, like you see, the process is so straightforward. I had my first one. Did I have any side effects? Everything's got side effects. Some people have side effects too. Some people don't even,
you know, they react to water. Do you understand? Paracetamol's got side effects. Everything's got side effects. Did I have any side effects? Yes, I did have side effects. I had a sore arm. I had a very mild fever, and just aches and pains. But it was nothing that paracetamol could not handle. So just using paracetamol and some bed rest, within before 48 hours was over, I was back to my normal self and up and about again. Not that I wasn't bedbound or anything, but the whole side effects had gone. And most people would say, sometimes the second vaccine may give you more side effects. But actually, funny enough, with the second vaccine, it was just a little bit of an ache in my arm, and that was it. So I was actually better with my second vaccine than the first vaccine. And so I'm just extrapolating, going through to having the vaccine. It was something that I didn't have that discussion with my mom whether she should have the vaccine or not. For her, it was just a straightforward decision. She was going to have it. I had the Pfizer vaccine. My other relatives, my siblings and my mother, they had the AstraZeneca vaccine, and absolutely none of them had any side effects. So every single person is very different, and I did not tell them not to have one or to have the other, but it was a personal decision they made themselves that they were going to have the vaccines. They've had two vaccines and they are fine, and I am so glad that they have. And it's a fight we're all in. It's a fight the whole world is actually in. It's not something just for England or one part of the world. It's the whole world. And getting vaccinated is one step forward, to winning this war against COVID. So having the implant or being on contraception actually is not a reason that you cannot go ahead to have having the vaccine. I mean, I wonder how many people we vaccinated. I'm sure there are millions and millions of people all around the world who are on implants or on contraceptive pills that have had the vaccine. So we don't need to go through that process of taking it out, putting it back in. Absolutely not. You can go ahead and have your vaccine without having to make any changes to your contraception. We wouldn't want an unplanned pregnancy either, because of any accidents that happen. So being on the pill, being on medication is not a reason to avoid having the vaccine. So it's absolutely safe for you to go on. You've had the first one, that's fine. Go ahead, have the second one. You don't have to worry about changing anything about your contraception at all. It's okay to go ahead.
And the other thing I'd mention is the implant actually only has progesterone. So it's not the same as the pill I was talking about. So it doesn't actually increase your risk of clots, which is great. So don't worry about that. If you want to change to the IUD, that's fine if you'd like to, because of the choice of your contraception, but don't do it because of the vaccine. Not related. So yes, so there's 3 in use at the moment in the UK. It's the Pfizer, the AstraZeneca, and the Moderna. But what we're delivering now is the Pfizer and the AstraZeneca. I am not going to recommend one over the other because you may have heard this said, but the best vaccine is the one that you can get as soon as possible, because then you're reducing your chance of COVID. The Pfizer, all of them, as Dr. Funmi said, everything has side effects and everything has risks and benefits. So the Pfizer, you have to wait for 15 minutes after you've had it because there's a very small risk of an allergy to it. So actually, none of them come without weighing up the risks and benefits, but they're all incredibly safe. Incredibly safe. We were talking about this beforehand and we were saying if you want to know a bit about safety, read any of the leaflets for any medication. So paracetamol, if you look at the leaflet, you might be surprised because legally they have to write all the side effects that anyone has experienced. So there could be a lot of different side effects. But vaccines are one of the safest types of medical care that we can give you, really. So either of them, I would recommend either of them. I think that's a really, really good question. Funmi, do you want to answer that?
So when you get an infection, infection like COVID or whatever type of infection, viral infections, people, your body creates antibodies, yeah? But everybody is very, very different in how they respond to infections they have. So some people create a little bit of antibodies, some people create more antibodies than the other. Sometimes with some infections, they have antibodies that last a lifetime. Sometimes it's just for a very short period of time. With COVID at the moment, we do know that people create antibodies. Yeah. But one thing is that everybody creates antibodies to different levels. Some people may not even create antibodies that last more than a couple of months or a week or so. And some people may create antibodies, a lot of antibodies that last months and months. So what we don't know is how long these antibodies will last. For some people, we think that maybe COVID hasn't been with us for a very long time, but the thought is that these antibodies may last. For those who create a good amount, may last for up to 6 months. So, and then other people who've had COVID may have antibodies that don't last at all. So with that thought in mind, we give the vaccine even if you've had COVID, because we do not know how much antibodies you've made or how long those antibodies will last. So with the vaccine, we feel the antibodies will last that you create to prevent you having COVID again or having COVID at all is going to last a longer period of time. And actually having 2 vaccines makes this even much longer than having 1 vaccine. So whether you've had COVID or you've not had COVID, go ahead and still have the vaccine, because yes, you may be slightly protected. We do not know how much or how long for, but with the vaccine, we have a clearer understanding of how long and how much, for. So having COVID in the past does not stop you from having the vaccine. So still go ahead and have it.
We have to admit that we don't know everything right now. So, we need to be humble about that research is ongoing. We make all the decisions we can to the best of the current knowledge we have. So with the variants, we've got, the South African variant that we're concerned about, and the other one as well. And what the current knowledge is that they do protect, they do give some level of protection against everything that's out there. But they are already starting to make booster doses. So possibly having vaccines every year just to keep you boosted against all the local variants. And viruses are really, really clever. They can do these mutations and they can change, but the scientists are working at that speed as well to make sure that we are going to fight any variants that come. So it will likely be booster vaccinations, but we know that the current vaccinations protect against the majority of COVID. So you'll be pretty much protected.
Just to add to what you said about the mutations, you may not know, but the flu vaccine changes every single year, because the flu virus mutates every single year. So the flu vaccine actually, changes every single year. So, and because the technology is there already, we're able to make new ones. So like Fatima said, if for any reason, if this vaccine, although we know that it works for the variants, doesn't work, we've got that technology there to quickly make new ones.
So currently, you cannot mix and match. So currently, if you're given one vaccine, the second one will be the same. And the reason for that is we don't have a huge amount of data about what happens if you mix and match. So because everything's changing so often, and Boris Johnson is showing his face every few days to tell us something new, so he might suddenly tell us that actually we can mix and match. So it's a kind of watch this space. We don't really know what's happening, but currently we're giving the same as the first one that you had.
There's some trials going on at the moment with AstraZeneca and Pfizer to see if, to see the effect of mixing and matching. So those questions are actually being, we've been thinking about them, and trials are actually ongoing to see if it is okay to mix and match. Like Fatima said, the intention is not to mix and match, although, I suppose in exceptional circumstances where someone forgets what they had the first time and there's no record of it, it could accidentally happen, but the intention is not for it to happen. Trials are going on, and until we know the result of the trials before we can actually be able to answer that question if it's a yes or a no.
So if you have a GP, that information gets through to your GP. So when we do the vaccinations for everyone, we have a national register where we put the fact that you've had a vaccine, and that's for safety, really, to make sure when you come back for the vaccine, we can see what you had for the first one, and we can see that the time period between the vaccines is the right time period. So it's all on this database called Pinnacle. And so basically, what I would do if I wanted proof is maybe ask your GP to just print that page that says COVID-1 and COVID-2 for the both vaccines that you've had. It should show up on your medicines list. The other thing you can do is they should give you a little card. Oh, I don't know if I have mine. I'll get mine out when Funmi's talking. A little card that says the first vaccine and the batch number, and the second vaccine and the batch number. You could use that. You could show people that. So that's also fine. So hopefully that'll be enough for now. But again, the government might introduce something else. Who knows right now? But yeah, I think that should be enough for now. So I think we've discussed the side effects that can happen, usually sore arm, sometimes feeling feverish or achy, body aches, feeling tired, sometimes a mild headache. So they're usually the short term, and then the longer term risks very, very, very low of anything bad happening. So these are kind of like, 1 in a million type situations that are happening. So I think we address that in the presentation as well.
I don't think there's any evidence to suggest that happens at all. This is the first, time I've heard this. It's certainly not a known side effect, and there should be absolutely no issues with your periods. After having the vaccine, it has no effect on your periods, and I would actually go and extrapolate that to say that it has no effects on your fertility as well. So the vaccine has no effect on your monthly periods, and it has no effect on fertility. No, there's no evidence to suggest that at all, that is the case.
So currently there's not really an option, and generally if you go to the vaccination centres and the pop-up clinics, it's usually the AstraZeneca because of the portability, and if you've had whatever you've had as the first, they'll give for the second. So if you've had Pfizer for the first, you'll get Pfizer for the second.
I'll just tell you, signs of blood clots generally anyway, could be calf pain, calf swelling, calf tenderness. So the back of your leg is painful, it's tender, it might be red, it might be swollen. That can be a sign of a blood clot, although not necessarily linked to the vaccine. That is one sign of a blood clot, maybe linked to other reasons. Chest pain, breathing, if you take a deep breath in and you've got chest pain, breathing difficulty, that could also be a sign of a blood clot. But the one that we're worried about with AstraZeneca, the 4 in a million one, was a very, very rare type of blood clot that, you may get a headache. So it's not the normal, everyday headache that you get. You may get a severe headache. It's not relenting, not getting better. You can use paracetamol and it's just there, and it's been persisting for more than 4 days. Or the headache is so bad you're vomiting, you've got visual changes, you just feel unwell. It's not the type of headache that you've known before, and sometimes because of the type of clots they're talking about, you may actually have bruises on your body. You may get bruises because it's a specific type of clot that actually you bleed more than a clot more. So it's a bit confusing trying to explain it, but you may get bruising everywhere accompanied with that headache. If you get that, get urgent medical attention. You may have to just go straight to A&E because it could be that bad enough. But if you're not sure and you're just not really sure, is there something to worry about or not, then speak to your GP, call 111, speak to your GP, and to discuss, and then they can decide, if they feel this is serious, or if there are concerns that have been raised, that, there's some red flags, there's some things about the clot that just not, about this headache, or, that are just not normal, then speak to someone. So the first thing is that the vaccine does not affect your fertility. It has no effect on your fertility. Yeah. So that's just a no.
And
Has no effect on your fertility.
yeah, just to add to that, quite a few people have gotten pregnant after having
exactly after the trial.
So it doesn't make your fertility worse or better. It's irrelevant to fertility. Just as people get pregnant normally, they got pregnant after having the vaccine as well with no issues.
So in terms of like pregnancy, and I'll actually go to breastfeeding as well, about is it okay? Okay, the breastfeeding answer, the pregnancy answer is not as straightforward as the breastfeeding answer. When vaccines or medications are made, they are not trialed. You do not have medical trials on pregnant women or breastfeeding women. You don't test new medicines on them. So this vaccine was never tested on pregnant women or breastfeeding women. But one thing we know is that the Joint Committee for Vaccinations and Immunizations and World Health Organization and other bodies have concluded that there's no evidence that it affects a breastfeeding woman in any way. So the thought is that the general advice is that if you're breastfeeding, you should go ahead and have it. Now, with pregnancy, you have to take a little bit more, caution. One thing it is said that, you need to assess each person as an individual. For instance, and it's not a yes or no answer, because pregnant women may go ahead to have it. You need to assess each woman. For instance, if the woman works a very high risk job, that if they catch COVID, they could be severely unwell. For instance, a frontline pregnant woman who works in ITU, or works in some kind of situation, or they have an underlying medical condition that makes them a very high risk to catching COVID, then that's discussion would have to be made, and it's risk versus pros versus cons, to think about, is it okay to go ahead? And it's a decision that, so it's not a no, like, no, don't have it. But it's each person needs to be risk assessed to see if they, possible low risks of having the vaccine outweighs the high risks of having COVID. So it has to be done on a case by case basis. So it's still, it's an area that there's no yes, go ahead and have it, or no, but each person needs to be really assessed, and the discussion needs to be had with each person as an individual to see, is that okay, or should I,
Yeah, and just to add that, I'm not sure if you said this for me, sorry, I was reading the questions, but the fact that not a huge number of pregnant women, or very, actually no pregnant women were in certain parts. Yeah, so we don't have, that's why. It's not because we think it's unsafe, it's just because we don't have that data necessarily. And some women in the trials did get pregnant after having the vaccine. Yeah, so we generally say, I'm not sure, Funmi, if you can correct me, we're saying if you're planning a pregnancy in the next 3 months, then you might want to delay the vaccine, but there's no real harm that we know of in having it.
We don't know, like we mentioned here. So because the trials do not, no drug trial involves, so the pregnancy one is, not a clear answer, but breastfeeding, no, it's okay to go ahead. It's okay to go ahead and have it. Doesn't affect your fertility. But with pregnancy, each case, it's a case to case, discussion about it.
COVID is a virus. So it's actually in a similar virus family to the common cold. But What COVID does that the common cold doesn't do is that it has the potential to be fatal, and it has the potential to cause very severe disease that can make you end up in ITU, or again, like we spoke about, long COVID, which is ongoing symptoms. So the way COVID spreads is by person to person contact, so person between people, between human beings. And really it spreads through respiring, so through breathing and the droplets that come out when you breathe. So that's why coughing or sneezing, they can spread those droplets a lot more. And you know, you may have heard about that, the 2-meter distance. The scientists chose that 2-meter distance because, say you were speaking to someone or coughing, the droplets are unlikely to go that far. And that's why coming closer to someone, it doesn't mean that, you know, you'll drop dead as soon as you come close to someone that has COVID, but those droplets you end up breathing them in, they land on your mouth without realizing it. They're very, very small. And also sometimes, you know, traveling in the air, that the small droplets in the air, you can breathe them in without realizing it. And that's why we're saying masks as well. It makes sense when you think about that. You know, sometimes when you speak, you get carried away and there might be a bit of spit that comes out. And if that spit carries COVID, you might catch the COVID. Not everyone will get it. Not every single person that gets a bit of that is going to catch it. That's what you may have heard in the news. They talk about the R number. That's kind of, it means like how many people are going to get infected from one person that has the disease.
Well, one thing we know about COVID is that the symptoms vary from person to person. So some people actually have COVID and they have absolutely no symptoms. They don't even know they have COVID. But some people have COVID and they have every single symptom and end up in ITU, and people lose their lives to COVID. So we know that it is such a serious medical condition, but it varies from person to person. And that is why that wearing your mask, keeping your distance from people is there, because it's possible that someone who doesn't know they have COVID passes it on to someone, you know, who is at risk, and somebody else can die because, you know, it's spread that way. So that is why it's so important to follow the guidelines, to follow the rules, and to, you know, keep your distance from people, because we just don't know. You know, we're still fighting this. The fight is not over, but the vaccine is there to help. And one thing you mentioned also was that you understood that the vaccine doesn't stop you from that. You've heard something about the vaccine is not 100%. One of the things the vaccine does not necessarily do is that, so if you've had the vaccine, it reduces your chances significantly of having COVID that makes you land in hospital, or having COVID that makes you ill or severely unwell. So having the vaccine stops you from getting the actual disease that, you know, makes you very unwell, but it doesn't stop you from actually still having it in your airways, which means that, so whilst you've had the vaccine, you still need to follow those rules, because there are other people who may not have had the vaccine or who may still be at risk, that you could still give COVID, even though you yourself do not have any symptoms of it. So the vaccine stops you from getting a clinical disease, stops you from getting ill with it. So the vaccine is very effective in that way, but it doesn't necessarily mean that you cannot have it on your body and give it to somebody else. So that is why it is still important, after having the vaccine, to still take those precautions until we are so sure that COVID, you know, is a very, very tiny risk in the whole of the population, in the whole of the world even. So it's still important to follow the guidelines. The vaccine still has a significant positive role in reducing the risk of having COVID in each individual, you know. So I don't know if I've answered all the questions, if we've answered all the questions.
Just to add to that, what you said, so it's over 90% effective. So that, you know, that 90% chance of not getting COVID compared to someone that hasn't. So much lower. 90% is still huge. And then those people that do get COVID get the very, very mild form.
Okay. Yes. Okay, I mean, we all know that the COVID vaccine rollout only started around late last year. So, you know, I think it's thought, like Fatima said, maybe up to a year protection. So I think, you know, it's not going to be surprising at all if COVID vaccine becomes a regular yearly vaccine for the whole population, it's possible that may be the case, but it's not long life, definitely not, and it's certainly in the region of probably 9 months to a year or so. And there already talks about booster doses as well, so we need more information about that.
The thing with the booster doses is because it's not actually making a new vaccine, it's just slightly amending, slightly changing the one that's there. So it should be pretty easy. So I think within the next few months, they're already going to have booster doses ready for us. It just is important to for all of us to keep talking about why this is important, because having it now to protect us now is great. So we can also lower the amount of COVID in the population to hopefully get rid of this completely, because that's what the idea is. If everyone in the world can have the vaccine, and then we can hopefully try and eradicate this. So the immune system is basically the body's defense against disease. That's all the immune system means. And giving the vaccine is basically giving, I keep using this analogy, and maybe I need to find a new one about the soldiers, but it's basically giving you newly trained soldiers for this specific disease. That's it. It's just adding to the army. It's not creating anything. Like, you already have an army in your body. You're born with immunity, actually. So but as your life develops, you develop immunity to various different conditions, and the vaccines give you extra immunity to other conditions. No, it's not. It's optional and it's your choice. And me and Funmi being here is basically to equip you with as much of our knowledge and our awareness of the research, so that you're able to make your own decision. Me and Funmi, obviously, we've both had it, so we strongly believe that it's a very, very good thing. I will speak to all my family members about how important this is, everyone that I love and care about. And all my patients, and anyone that asks me, I will say that that's what I would recommend. I would absolutely recommend to take the vaccine, because I really, really want to see this disease gone, and I don't want to hear of another person that's sick. We're in the process of the vaccination, so we won't be able to see all the effects right now. I think ask that question in 3 months, 4 months time, and then we'll be able to tell you how much vaccination has helped. And I think the UK is really going to see it, because we've had a really good number of people being vaccinated. And the reason we want to talk to all of you as well is that we know that more white people have been vaccinated than black people, more white people than Asian people, for example. So we know for some reason that our communities are maybe struggling a little bit more. So also people who are refugees, people who are asylum seekers, migrants, people who may not have as easy access to healthcare. So that's why it's really important that everyone has the right to have this information. Everything we've spoken about today, everyone should be able to have the right to make their decision from this information. So I think, yeah, again, a political question, but I do think the vaccination, we're going to see the benefits of it very soon as well, if we're not already doing so. So I think that's come to the end now, but any questions that we didn't answer, please send them on to Vicky and Venus, but I think we've covered most. And all the best to all of you. Thank you so much for joining.
Thank you so much, Dr. Fatima and Dr. Funmi. That has been great. I think I find it so useful for me as well. And I hope everyone got something out of it. But thank you for your time and your patience and the information. That has been great.
Thank you very much.
Thank you.
Thank you.
Bye-bye.
Bye. Take care.
Everyone.
Thank you so much.
Bye.
Stay safe.
Yeah.